I'm Mary Lagnado. Good morning. I'm the Assistant Superintendent for Westbury Public Schools. And today I'd like to acknowledge that I'm accompanied by our President of the Board of Education, Karen Campbell, and our Food Service Manager, Mike Gongas. And it is an honor to present to you today the Westbury School District's innovative strategies in providing a healthy breakfast and to help students raise alertness and performance. The Westbury School District in Westbury, New York began the Universal Breakfast Program as a pilot program in March 2009 with the goal of providing students with the proper nourishment to start their school day. The connection between nutrition and optimal learning has become increasingly clear, and the Westbury School District's commitment to this program is part of our overall mission to educate the whole child and help every child succeed. We currently serve a population of 4,200 children with 4 elementary schools, 1 middle school, and 1 high school. Our demographics are such: 61% Hispanic, 35% Black, 2% white, 1.1 Asian, 0.3 multiracial, and 2 American Indian. Approximately 1/3 of our student body are English language learners. Our free and reduced lunch rate is 84%. As you know, that's what denotes the percentage of families living at or below the poverty level. With the current pilot program at the pre-K and the kindergarten levels, students are served a hot and cold breakfast in their classrooms, while at the elementary and secondary levels, students who wish to participate eat a hot and cold breakfast in the cafeteria. As Congresswoman McCarthy has said, students are led directly by the school staff from their buses into the cafeterias to eat this breakfast. We will fully implement the Breakfast on the Go program this coming November, and we're thrilled about it, with the goal of making breakfast accessible to every student. Under this program, pre-kindergarten and kindergarten students will continue to eat breakfast in their classrooms, while elementary level students will receive a bagged or boxed breakfast upon exiting their school bus to eat in their classrooms, and other students at the secondary level will arrive by bus 15 minutes earlier to allow more time to eat their breakfast. As a background, in 2004, an obesity study was performed in our schools, in our high school, by the school nurse, which indicated that a majority of our high school students were overweight. To address the healthy eating solutions, the superintendent, the high school nurse, and I decided on a specific course of action. And we formed the Nutrition Committee with the overall idea to effect a paradigm shift in the food served and selected in the school cafeterias through awareness and a district-wide commitment to helping students and the community. The idea of sustaining a balance in metabolism to permit sustained concentration and endurance for more effective and efficient student achievement is the heart of the purpose. We formed an action plan, and what better to start with the need of the day, breakfast. That was the aim of this Nutrition Committee. We had a plan of action where we collected data, we visited the schools, we observed the food choices available in the cafeteria, we had vendors present nutritious choices for us to consider, we shared recommendations with the staff for changing the school menu, not only to replace drinks and snacks with the more nutritious ones, but this is the following what we did. We replaced white flour bagels with whole wheat bagels, multigrain muffins, and non-sugar cereals. We reduced the portion of high-content carbohydrate foods and added fresh fruits and selections. We also drafted our wellness policy, which included nutritional guidelines and had food choices and for our Board of Education to approve. We also recognized that we needed to have different eating habits and include exercise. In addition to this, we also started Family Nutrition Information Nights. These are held at night at our elementary schools, and the workshops are conducted by medical professionals, and one of these partnerships institutions is the Institute for Healthcare Disparities at the Nassau University Medical Center. A demonstration using cultural foods to prepare healthy meals and samples of healthy snacks, as well as cookbooks in English, were distributed. So we are really thinking out of the box. In summary, the interesting thing is that our school nurses have reported that there has been a substantial increase in awareness that nutrition has on students' health and performance. District data shows an improvement in ELA and math scores on the New York State assessment. Academic intervention strategies coupled with the Healthy Choice initiatives have resulted in this improvement. Traditionally, students are more alert and engaged in morning classes, in large measure due to the impact that these healthy choices have made in the overall well-being. Our high school principal has observed that students are less lethargic and more focused. In addition, building administrators have noted less disruptive behavior in the classrooms and hallways. So we are very pleased with the Breakfast on the Go program. We are going to institute it in November. We were very successful. The results were that we have increased our breakfast participation by 25% using this new initiative. And I just wanted to tell Congress how important this program is to a school like ours, which is a high-needs district, and we really use the funds. What I'd like to recommend is that districts be given more commodity foods that can be used in preparing the breakfast menus, and also that there would be an increase in the per-meal reimbursement to school districts as a financial incentive to school districts to make the program more financially feasible. Thank you.